Well, hello again. It's Bruce Williams, and today I'm going to present the 6th lecture in my series on the selected gross pathology of small ruminants, and we're going to talk about the urinary system. But before I do that, I want to thank all of my friends and colleagues who provided me these fantastic images over the years. Let's start with the non-bleaching that you can occasionally see in the kidney. If you look at the blackish discoloration here at the corticomedullary junction, there's a couple streaks here in the medulla, or on the surface of this pale kidney. This is a condition that is known as pseudomelanosis. It's normally seen in decomposing animals, and it's the result of production of hydrogen sulfide by gut bacteria after death, and this gas will leach through the wall of the intestine. And if that loop of intestine is lying on top of another organ, that hydrogen sulfide will interact and oxidize the iron in hemoglobin and result in this blackish discoloration. So that's pseudomelanosis, not a real lesion. Okay, in young sheep and goats, hypospadias, or an abnormality of the elongating penis, will develop from the failure of fusion of the urethral groove, which will result in the urethra being open to the external environment. So what we're looking at here is we're actually looking down into the penis, which never fused on its ventral aspect, into the urethra. This can happen at all areas of the developing male tract. It can happen in the glandular areas along the length of the penis or up to the urethra, or even in the area of the anus. These animals are occasionally cryptorchid as well and have a poorly formed or a non-formed scrotum. Here the testes are present, but in the inguinal skin on either side of the bifid penis. The cause is probably multifactorial. Genetic abnormalities have been postulated because you see them in certain lines of small ruminants. And environmental factors such as environmental estrogens have been incriminated, including plant estrogens such as what you might see in red clover or soybean meal. So this is Hypospadias. Another pretty rare condition in small ruminants is polycystic kidney disease. You might not even recognize this kidney as a kidney. I assure you that it is, but it is much larger than normal. And this young animal, which was either delivered stillborn or maybe only lived a couple of days after birth, probably had a swollen abdomen due to the presence of these two very large kidneys. There's really no functional tissue here. The tubules are extremely ectatic, as are the glomeruli, and they might not even be linked up. And this is very characteristic across species for autosomal recessive forms of polycystic kidney disease. And these lambs, as in a number of other species, often have cysts in other organs as well, including the liver, where the biliary tract is poorly formed, or the pancreas, or the epididymis. Okay? Recessive forms of polycystic kidney kill them quick. Here's another picture of one bisected shrunken kidney. This kidney is diffusely hard and has a lot of fibrous connective tissue, which gives it not only this pale color, but also there is fibrosis, probably pressure necrosis of the renal crest and significant retraction. You can see all of these cysts. Animals with adult dominant forms of polycystic kidney, and all of this is genetic. The genes which control tubular differentiation have been identified in people. They've been identified in certain breeds of cats like Persians and cattle, but not in small ruminants, so I'm hesitant to ascribe it to any particular gene. But in the adult the autosomal dominant forms of polycystic kidney. It's more of an adult onset. The kidneys are normal at birth and become progressively worse over time with loss of nephrons and fibrosis. So, adult onset or autosomal dominant polycystic kidney disease. Neither are very common in small ruminants. If we move on to the bacterial conditions, you're hard-pressed to even recognize these kidneys as kidneys. They have an advanced level of autolysis that was much more than the rest of the organs in this animal, giving rise to the name of pulpy kidney disease. Pulpy kidney disease is a characteristic sign of enterotoxemia in small ruminants, which we've talked about before in one lecture, and we'll talk about again in another. It is a multisystemic condition which starts by the ingestion of high levels of carbohydrate and then a change in the bacterial flora with overgrowth of Clostridium perfringens type D in the gut. This particular bacteria produces a very specific toxin, the epsilon toxin, which binds to gut endothelial cells, causing retraction. And at this point, that toxin is free to get into the circulation, go anywhere in the body it wants, setting up hemorrhages throughout the body, especially in the GI tract, necrosis and hemorrhage in the brain and in the kidney, widespread acute tubular damage due to ischemia, and histologically widespread tubular epithelial necrosis. Nobody really knows why the kidneys are so far advanced in autolysis from the rest of the body. People put forth the idea of that glucose accelerates the process. These animals are in shock and have very high levels of blood glucose. Never been proven that that really makes any difference, but a very characteristic finding of, I like the term precocious autolysis or pulpy kidneys in animals with enterotoxemia. Other bacterial infection, nothing much to see here. We've seen this in other lectures, but here are multiple lamellated abscesses due to Corynebacterium pseudotuberculosis. About 20% of the animals with skin infections, of which Corynebacterium pseudotuberculosis is most well known for, about 20% of those animals develop internal abscesses as a result of Corynebacterium pseudo-TB getting into the bloodstream. And so you can see abscesses just about anywhere, and kidney, liver, multiple lymph nodes, not too uncommon. And these are acute septic infarcts, which we can see in this pale kidney. The thrombus is always at the point of the triangle here, probably in the interlobular arteries, because these particular acute red arterial infarcts are confined only to the cortex. If you see this, the first place you want to look is the heart, especially the left side of the heart, where if this animal has vegetative valvular endocarditis, the incrustations of fibrin and bacteria are pretty flimsy and will break off and enter the systemic circulation. They're going to float around until they find a place where the diameter is too small, and that's always going to be, or ultimately going to be, the kidney. So the combination of septic infarcts in the kidney and lesions on the heart valves is very well documented. How do you get vegetative valvular endocarditis in sheep? Well, you see it not too uncommonly in experimental settings. They're used a lot in laboratory animal research. They will have indwelling catheters for a long bit of time, and that's a great portal to get bacteria directly into the bloodstream. You can also see it as a result of chronic lung disease, foot abscesses, or in the very young animal, omphalophlebitis. And those animals with chronic bacterial infections will often set themselves up for another problem that you can see in sheep, and that's amyloidosis of the kidney. You can see it primarily in the glomeruli. About 75% of cases are glomerular, but about 25% can be in the medulla as well. Amyloidosis is not a great gross picture. It can be very difficult, and sometimes all you see is an enlarged kidney. And when you only have part of the kidney and you don't have any ruler here, it can be very difficult. Now, in cases in which it's in the medulla, the presence and the pressure caused by the amyloid will result in necrosis and retraction of the renal crest. Anytime you have anything that causes increased pressure on those wimpy little vessels in the medulla called the vasa recta, you set yourself up for papillary necrosis and retraction. So amyloidosis, look for it in any small ruminant with chronic foot abscesses or other chronic diseases, maybe chronic pneumonia. And you can see it in just about any organ in these animals. Well, here's a picture that should be very familiar to you now. The blue-black colored kidney of the animal with acute tubular ischemic injury and hemoglobin uric pigmentation. Some people call this hemoglobin uric nephrosis. I'm not crazy about that term. I'll say it again. Hemoglobin doesn't cause a lot of tubular damage. It is a very, very weak oxidizing agent. It does have iron in it. It can incite the Fenton reaction, but it's pretty minor. The insult to the kidney, which causes the widespread necrosis in these animals, is a result of severe hemolysis and decreased oxygen carrying capability of the blood. That hemolysis also brings the hemoglobin to the kidney. Remember that copper is stored in both the blood, where it's bound to ceruloplasmin, and in hepatocytes. But because sheep are so sensitive to copper, they find a lot of ways to poison themselves. Whether they're chewing on copper wire, they are eating horse feed, which has just marginally increased amounts of copper, or they have decreased amounts of sulfates or molybdenum in their diet, which allows them to absorb more copper. They're just waiting to get copper, and the kidney is severely affected by the vicious cycle of hepatic necrosis, release of copper, and intravascular hemolysis that you see. This particular kidney just has that sort of blue-black pigmentation here. This is an early case in which there is definitely a color change. Whenever I see color changes in the cortex of the kidney or a color change in the liver, and I know it's a sheep, I'm always going to think, just for a fleeting moment, could this be copper? The medulla here is sort of pink, which suggests very early hemolysis. And as that hemolysis gets worse, the cortex will get a much darker color because of the accumulation of hemoglobin, and the pelvis and any abdominal fat will reflect the icterus and turn bright yellow. The color of this particular liver isn't necessarily horrible as livers go, but the fact that we have a very large gallbladder suggests that the liver is smaller than normal. And with the presence of these kidneys, it's still going to be copper. You know, there are a couple of breeds of sheep which normally are raised in copper deficient areas, including North Ronaldsay sheep. And they are actually so incredibly sensitive to copper. You can't take them anywhere else because normal copper rations for sheep are enough. There's enough copper in there to kill them because they're used to a very small amount of copper. So this is a great non-lesion. We're looking at the kidney of a Angora goat. It's pretty well restricted to Angora goats. This particular change, which you see in the cortex, and the cortex only, what we're looking at here is all of the tubules, the basement membranes, have deposits of hemosiderin and ferritin on them, which outlines them very darkly. The name of this lesion is the Cloisonne kidney because it's reminiscent of cloisonne jewelry, in which bits of brightly colored enamel are separated by copper wire. And that's how it gets its name. It's thought to be due to erythrocytic fragility due to a low level of glutathione and glucose 6-phosphatase in these animals' kidneys, and mild hemolysis, and the iron pigments will precipitate out into the basement membranes of the tubules, but nobody's totally worked it out, although this lesion's been around forever, or non-lesion, so to speak. This is and I would have to tell you the history that this is the kidney of a 4-month-old Finnish landrace lamb. And the pallor of the kidney, if you've looked at the urinary system lectures, when we see this diffuse pallor, the thing that you want to think about is advanced tubular injury, acute tubular necrosis, or probably a better term is ischemic induced tubular necrosis. Finnish landrace sheep have a particular form of glomerulonephritis resulting in deficiency of the third component of complement. And within the glomeruli of these kidneys, this is a severe and wide-ranging glomerulonephritis. One of the functions of the third component of complement is to maintain the solubility of immunoglobulins within the blood. And because these animals are deficient in C3, they get tremendous deposits of IgM and IgG and even IgA in these glomeruli. As soon as they're born, they start developing glomerulonephritis, and usually their lifespan is less than 4 months of age. So it's a particular disease to a particular species of lamb. It's an animal model for the development of glomerulonephritis. And I mention it because one of those things you want to know about in sheep if you are preparing for any type of certification examination. There's really not a whole lot of neoplasia of sheep. This is a sheep with severe hydronephrosis as a result of the compression of the ureter, not by a primary urinary tumor, but a large uterine smooth muscle tumors. We will talk about that when we get to repro. Especially goats have a lot of leiomyomas of the uterus, or fibroleiomyomas. They can attain a rather large size, and this one did, and it compressed the ureter, which was passing by, and resulted in obstruction and hydronephrosis. Probably the most common neoplasm of small ruminants is lymphoma. A very nice retrospective was published by Dr. Christiane Lohr of Ohio State, probably getting up to 9 or 10 years ago, on 102 neoplasms of goats, and lymphoma was the most common, with 17 of the 102 neoplasms being lymphoma. So this is lymphoma. We can see it both in sheep and goats, and they have very few primary tumors, but a lot of renal lymphomas. So their most common kidney tumor is not a kidney tumor at all. Urolithiasis. Urolithiasis can be a real problem in breeds of in herds of small ruminants as a dietary problem. Urolithiasis is almost always dietary in small ruminants and in production animals, and you have to examine what you're feeding. It's most commonly seen in animals with high levels of concentrate and low levels of roughage. And concentrate seems to be very high in phosphorus and phosphates, and it's often Calcium and phosphates are the two most common components of urolithiasis in small ruminants. Most of the phosphate that is excreted from the body is excreted in the bile or the feces. But if you have elevated levels of phosphate, such as an animal that's eating a lot of concentrate, then more of it will be excreted in the urine. And that's where you get into trouble, especially in the higher pH urine of herbivores. Calcium oxalate, calcium phosphate, and other phosphates, as I said, are the most commonly seen. And due to the unique anatomic structures, especially of goats, you often will see obstruction in male goats. The condition is known as waterbelly. They do have distension of the abdomen, and in this weather here, we have marked swelling of the penis as well, probably due to urethral rupture. And this is what one of those looks like. In the small ruminants, the penis is extremely narrow, and goats have a urethral process which is even narrower. And in animals with large numbers of phosphate calculi, these are interesting. They're great shape. You can almost make jewelry out of some of these in sheep and goats. These phosphate calculi are sort of grayish black. They look like little BBs, and you can have lots and lots of them. What happens is they get caught down near the end of the penis and result in obstruction. Here you have pressure, necrosis, and extensive tissue damage. And at the end of the penis of the goat, there is something known as the urethral process. And I like to always say that form follows function. I have no idea why the penis of the goat was designed with this particular protrusion. Also, it's called pizzle. And the pizzle, when it's obstructed, will become gangrenous. You can't pass anything through it. The lay term for this is pizzle rot, usually the result of a urolith that can't be passed. It just seems like really bad engineering. So urolithiasis and obstruction in male goats, and to a lesser extent rams, can be a real problem. And that brings us to the end of this particular lecture. As always, I wish you the best of health in these troubled times. I wish you the ability to smile and laugh. I hope you've enjoyed this lecture as much as I've enjoyed delivering it. We will come back next time and talk about the nervous system of small ruminants, and I bet we're going to see our friend Clostridium perfringens type D one more time. So until then, be safe and take care. Bye-bye now.